How to treat and cure muscle fatigue. Muscle aches are also known as muscle pain, myalgia, or simply pain in the muscles. Muscle aches are extremely common. Almost everybody has likely experienced discomfort in his or her muscles at some point. Because almost every part of the body has muscle. The most common causes of muscle aches. Often, people who experience muscle aches can easily pinpoint the cause. This is because most instances of myalgia result from too much stress, tension, or physical activity. Some common causes include muscle tension in one or more areas of the body, overusing the muscle during physical activity, injuring the muscle while engaging in physically demanding work or exercise. Muscle sprains and strains are both injuries that can cause muscle aches and pain. Types of medical conditions can cause muscle pain. Not all muscle aches are related to stress, tension, and physical activity. Some medical explanations for myalgia include fibromyalgia, infections, such as the flu, lupus, use of certain medications or drugs, such as statins, ACE inhibitors, or cocaine. Dermatomyositis, marked by inflammation and a rash. Polymyositis, marked by inflammation and tenderness. Easing muscle aches at home. Muscle aches often respond well to home treatment. Some measures you can take to ease any muscle discomfort from injuries and overuse include resting the area of the body where you are experiencing aches and pains. Taking an over-the-counter pain reliever, such as ibuprofen. Applying ice to the affected area to help relieve pain and ease inflammation. Other measures that may provide relief from muscle pain due to a variety of causes include gently stretching the muscles, avoiding high-impact activities until after the muscle pain goes away, avoiding weightlifting sessions until the muscle pain is resolved, giving yourself time to rest, doing stress-relieving activities and exercises such as yoga and meditation to relieve tension. Muscle aches are not always harmless, and in some instances, home treatment is not enough. Myalgia can also be a sign that something is seriously wrong in your body. Pain that does not go away after a few days of home treatment. Severe muscle pain if you are unsure of the cause. Muscle pain that occurs along with a rash. Muscle pain that occurs after a tick bite. Myalgia accompanied by redness or swelling. Pain that occurs soon after a change in the medications you take. The following can be a sign of a medical emergency. Get to the hospital as soon as possible if you experience any of the following along with aching muscles. A sudden onset of water retention and/or a reduction in urine volume. Difficulty swallowing. Vomiting and/or running a fever. Trouble catching your breath. Stiffness in your neck area. Muscles that are weak. Inability to move the affected area of the body. Tips for preventing sore muscles. If your muscle pain is caused by tension or physical activity, take these measures to lower your risk of developing muscle pain in the future. Stretch your muscles before engaging in physical activity and after workouts. Incorporate a warm-up and a cool-down into all of your exercise sessions. Stay hydrated, especially on the days when you are active. Engage in regular exercise to help promote optimal muscle tone. Get up and stretch regularly if you work at a desk or in an environment that puts you at risk for muscle strain or tension. Your sore muscles might be due to something other than tension and physical activity. In this case, your doctor will best be able to advise you on how to fully resolve your muscle pain. The first priority will probably be to treat the primary condition. The following healthy lifestyle changes and tips can help keep you from hitting a wall in your workout. Nutrition. Maintain a well-balanced diet that includes complex proteins, fruits, vegetables, and carbohydrates. You should increase the amount of carbohydrates you eat, beginning 7 days prior to exercising, to about 40 to 60% of your caloric intake for aerobic athletes and 30 to 35% for anaerobic, non-aerobic athletes. This will maintain your muscles' glycogen levels, which are depleted during exercise. Eating schedule: eat a light meal or snack about 2 hours before working out. It is not recommended to work out on a full stomach or an empty stomach. Make sure to eat within 1 hour after you work out. This will help repair and refuel the muscles that were broken down during exercise. Hydration: drinking water throughout the day and drinking sports drinks during exercise is crucial to prevent dehydration, electrolyte loss, and muscle fatigue. It is recommended to drink 10-12 8-ounce glasses of water daily. While exercising, it is recommended to drink 125 to 250 milliliters of an electrolyte-rich sports drink every 10-20 minutes, or 1.5 liters per hour. This will replace the water and nutrients that are lost due to sweating. For endurance, improve your aerobic capacity. As your respiratory muscles begin to fatigue, oxygen will be redirected from the muscles of your limbs to those of your diaphragm. One way to improve your endurance is to gradually increase your aerobic workouts with interval training. You can also use a respiratory muscle training device, a piece of equipment that allows you to inhale and exhale against resistance, increasing lung capacity. Whatever method you choose, as your endurance increases, the added boost of oxygen in your blood will keep your muscles working for longer periods of time and prevent lactic acid buildup. Body mechanics: use correct form when exercising. Pay attention to muscle imbalances and incorrect movement patterns, follow a regular stretching program. The right strength and flexibility will help you achieve correct form during exercising. If you can't perform an exercise with proper form, then you need to either decrease your weight or modify the exercise. Improper body mechanics decreases efficiency and in turn burns more energy than necessary. Rest, recovery: complete a warm-up and cool down for 5 to 10 minutes each time you exercise. Start off slowly and gradually increase workout intensity levels so that your muscles are gradually challenged and can build over time. Allow adequate rest between workout sessions and strength repetitions. Make sure the rest break is enough to catch your breath between exercise sets. Listen to your body: fatigue is a sign that recovery has not taken place yet. If that is the case, then perform active recovery, which means participating in low-impact, low-intensity exercise such as walking, light swimming, or yoga. Do not return to higher-intensity exercise until you feel fully recovered and recharged. Topic overview. Weakness and fatigue are terms that are often used as if they mean the same thing. But in fact they describe two different sensations. It is important to know exactly what you mean when you say "I feel weak" or "I am fatigued," because it can help you and your doctor narrow down the possible causes of your symptoms. Weakness is a lack of physical or muscle strength and the feeling that extra effort is required to move your arms, legs, or other muscles. If muscle weakness is the result of pain, the person may be able to make muscles work, but it will hurt. Fatigue is a feeling of tiredness or exhaustion or a need to rest because of lack of energy or strength. Fatigue may result from overwork, poor sleep, worry, boredom, or lack of exercise. It is a symptom that may be caused by illness, medicine, or medical treatment such as chemotherapy. Anxiety or depression can also cause fatigue. Both weakness and fatigue are symptoms, not diseases. Because these symptoms can be caused by many other health problems, the importance of weakness and fatigue can be determined only when other symptoms are evaluated. General weakness often occurs after you have done too much activity at one time, such as by taking an extra long hike. You may feel weak and tired, or your muscles may be sore. These sensations usually go away within a few days. In rare cases, generalized muscle weakness may be caused by another health problem, such as a problem with the minerals, electrolytes, found naturally in the body, such as low levels of potassium or sodium. Infections, such as a urinary tract infection or a respiratory infection. Problems with the thyroid gland, which regulates the way the body uses energy. A low thyroid level, hypothyroidism, can cause fatigue, weakness, lethargy, weight gain, depression, memory problems, constipation, dry skin, intolerance to cold, coarse and thinning hair, brittle nails, or a yellowish tint to the skin. A high thyroid level, hyperthyroidism, can cause fatigue, weight loss, increased heart rate, intolerance to heat, sweating, irritability, anxiety, muscle weakness, and thyroid enlargement. Guillain-Barré syndrome, a rare nerve disorder that causes weakness in the legs, arms, and other muscles and that can progress to complete paralysis. Myasthenia gravis, a rare, chronic disorder that causes weakness and rapid muscle fatigue. Muscle weakness that is slowly getting worse requires a visit to a doctor. Sudden muscle weakness and loss of function in one area of the body can indicate a serious problem within the brain, such as a stroke or transient ischemic attack, or spinal cord camera.gif or with a specific nerve in the body. Fatigue is a feeling of tiredness, exhaustion, or lack of energy. You may feel mildly fatigued because of overwork, poor sleep, worry, boredom, or lack of exercise. Any illness, such as a cold or the flu, may cause fatigue, which usually goes away as the illness clears up. Most of the time, mild fatigue occurs with a health problem that will improve with home treatment and does not require a visit to a doctor. A stressful emotional situation may also cause fatigue. This type of fatigue usually clears up when the stress is relieved. Many prescription and non-prescription medicines can cause weakness or fatigue. The use or abuse of alcohol, caffeine, or illegal drugs can cause fatigue. Fatigue that lasts longer than 2 weeks usually requires a visit to a doctor. This type of fatigue may be caused by a more serious health problem, such as a decrease in the amount of oxygen-carrying substance, hemoglobin, found in red blood cells, anemia. Problems with the heart, such as coronary artery disease or heart failure, that limit the supply of oxygen-rich blood to the heart muscle or the rest of the body. Metabolic disorders, such as diabetes, in which sugar, glucose, remains in the blood rather than entering the body's cells to be used for energy. Problems with the thyroid gland, which regulates the way the body uses energy. A low thyroid level, hypothyroidism, can cause fatigue, weakness, lethargy, weight gain, depression, memory problems, constipation, dry skin, intolerance to cold, coarse and thinning hair, brittle nails, or a yellowish tint to the skin. A high thyroid level, hyperthyroidism, can cause fatigue, weight loss, increased heart rate, intolerance to heat, sweating, irritability, anxiety, muscle weakness, and thyroid enlargement. Kidney disease and liver disease, which cause fatigue when the concentration of certain chemicals in the blood builds up to toxic levels. Chronic fatigue syndrome is an uncommon cause of severe, persistent fatigue. If fatigue occurs without an obvious cause, it is important to evaluate your mental health. Fatigue is a common symptom of mental health problems, such as anxiety or depression. Fatigue and depression may become so severe that you may consider suicide as a way to end your pain. If you think your fatigue may be caused by a mental health problem, see your doctor. Check your symptoms to decide if and when you should see a doctor. Health tools. Health tools help you make wise health decisions or take action to improve your health. Signs of stroke. Sudden weakness, numbness, tingling, or loss of movement in your face, arm, or leg, especially on only one side of your body. Sudden changes in vision. Sudden trouble speaking. Sudden confusion or trouble understanding simple statements. Sudden, severe headache that is different from past headaches. Sudden problems with walking or balance. Home treatment. If you have generalized weakness and fatigue along with other symptoms, evaluate those symptoms. Home treatment for your other symptoms usually will improve your weakness and fatigue. Mild generalized weakness and fatigue that occur with a viral illness usually improve with the following home treatment measures. Get extra rest while you are ill. Let your symptoms be your guide. If you have a cold, you may be able to stick to your usual routine and just get some extra sleep. If you have the flu, you may need to spend a few days in bed. Return to your usual activities slowly to avoid prolonging the fatigue. Be sure to drink extra fluids to avoid dehydration. If generalized weakness and fatigue are not related to another illness, follow the guidelines in the prevention section and be patient. It may take a while for you to feel energetic again. Listen to your body. Alternate rest with exercise. Gradually increasing your exercise may help decrease your fatigue. Limit medicines that might contribute to fatigue. Tranquilizers and cold and allergy medicines often cause fatigue. Improve your diet. Eating a balanced diet may increase your energy level. Do not skip meals, especially breakfast. Reduce your use of alcohol or other drugs, such as caffeine or nicotine, which may contribute to fatigue. Cut back on watching television. Spend that time with friends, try new activities, or travel to break the fatigue cycle. Get a good night's sleep. This may be the first step toward controlling fatigue. Eliminate all sound and light disturbances. Do not eat just before you go to bed. Use your bed only for sleeping. Do not read or watch TV in bed. Get regular exercise but not within 3 to 4 hours of your bedtime. Symptoms to watch for during home treatment. Call your doctor if any of the following occur during home treatment. New symptoms develop along with the weakness and fatigue. Symptoms last longer than 2 weeks. Symptoms become more severe or more frequent. Prevention. Mild fatigue can often be prevented by changes in lifestyle habits. Get regular exercise. If you feel too tired to exercise vigorously, try taking a short walk. Eat a balanced diet. Do not skip meals, especially breakfast. Get enough sleep. Deal with emotional problems instead of ignoring or denying them. Take steps to control your stress and workload. For more information, see the topic Stress Management.